Thank you for coming today. I am grateful to have an opportunity to talk about something we're hearing a lot about, but we have some folks today that know a lot more than some of us, lay people in this field, and so special welcome to both Jason and Terin today who work in this area and are doctors that I think have to regularly work with the public and reassure us and inform us and help us on this journey. I think part of our conversation today will also involve how do we be the church in today's world? It's certainly changing. There's certainly lots of questions, and we'll talk about that too. I have some questions that I'm going to ask. I don't have any answers, so I can just ask the questions. That's a good thing today. But at the same time, hopefully there'll be a chance for you to ask some questions as well. So we're going to begin. You want to tell us a little bit about yourself, you two? And what's really ironic is we only have 2 microphones down here, so these two have to share, okay?
We washed our hands before.
That's a good thing, and you're not having a fever, right? So no fever's going on over here. Good. Tell us about yourself.
So I'm Terin Sytsma. I am a new consultant in community internal medicine. I did medical school and residency here, so I've been in Rochester for quite a while.
And my name is Jason Post. I am a not-so-new consultant in community internal medicine, as you can tell by my hairline and waistline. But I came from Iowa, where I did medical school. But both Terin and I work in community internal medicine, seeing local patients in the community.
All right, thank you. So what do we know, I don't know, maybe about the origin of COVID-19 or the coronavirus? Put this outbreak in a context for us.
Yeah, so the virus started initially in central China, in Wuhan City. Initially the thought was that it was spreading from a live animal market to humans, so it may have been a coronavirus that was initially in animals that crossed over into humans. The majority of cases have all been in China, but it started to spread to many other countries. I think latest CDC counts had it in over 80 countries worldwide, including the United States.
So tell us a little bit about the signs and symptoms of the coronavirus and how is it spread?
So coronavirus is going to be mostly like a common cold to influenza to pneumonia. So lots of signs and symptoms of that overlap. Cough, cold, feeling fevers, chills, body aches, lots of things like that. Very similar to influenza, and it can range from a very mild case like the common cold to very severe like a bad pneumonia.
Yeah, and I'll just add to that, this presents a lot like the common cold because coronavirus is a huge spectrum of viruses. And most of common colds are caused by one of these coronavirus viruses. And so while coronavirus has gotten a really scary name recently, when it first popped up, many of us were like, oh, okay, a coronavirus, that's not so concerning because that's what the common colds are generally coronaviruses. But because of that, it does present very similarly to cold symptoms. It just happens to be that this one is so much more virulent or dangerous as compared to the most other common colds. The biggest thing that seems to present with this coronavirus as compared to other viruses is that the fever seems to come on relatively quickly. So in listening to what patients have said who have suffered from this, it seems to be that the fever is relatively quick onset. And so as compared to a common cold, it's a lot more like influenza where fevers and headache tend to be much more of the presenting illness.
And similar,
Go ahead, no, ahead.
Similar to common colds, it's spread from person to person. So kind of those respiratory droplets that can pass along after you cough or sneeze and getting on other people. Most of the cases have been very close contact, so people that have been within 6 feet of one another or living in the same household, but it spreads very similarly to influenza as well.
You know, I think we hear some things that it sounds like there's some similarities with outbreaks we've had in the past and maybe not that long ago. So how is it the same maybe? How is it different? And does it feel like we prepared well for this?
Sure, I can take this, thank you. So this is similar to both, if people remember SARS or MERS. So SARS is the severe adult respiratory syndrome, or MERS, which is Middle East Respiratory Syndrome. They're very similar because those were both coronaviruses as well. And so this disease is spreading somewhat similarly to those, although unfortunately this one has been much more contagious. So SARS and MERS were both much more easy to contain in their countries of origin, whereas this COVID-19 has been much more, has been spread much more worldwide and much more easily. So it's much more, I think when I think about it, it's much more similar to influenza in the way that it's passed along. And so while we think about this as an outbreak, while it is, it's very similar in the way it's running through the world to influenza. And so I think it's very similar in that perspective, that it's transmitted the same way through respiratory droplets, meaning you cough or sneeze, or through just very close contact. And it just happens that as we travel, as people travel around, those close contacts infect one another.
I was having a conversation with someone the other day, won't name any names, but something that he said was, hey, we get the flu all the time, it happens every year, lots of people die from it, we should just kind of get used to this, or be aware of this, and not be surprised by this. So respond to that kind of comment you hear from people.
Yeah, so I think that's kind of a valid thing to say, in that we are used to seasonal influenza outbreaks. One of the things with coronavirus is we haven't seen one quite like this, as far as knowing if the change in weather pattern will change how the coronavirus spreads. Like we know with the flu, kind of in the spring, summer, it tends to die down. The concern is that it's going to other countries as well. The good thing is that same with influenza and coronavirus, we can prevent it in very similar ways. So by good hand washing, staying home when we're sick, and avoiding people who are sick.
Yeah, and I would add to that, I hear that commonly, and I think that comparing this to influenza, again, is not a bad comparison. The biggest difference is, one, influenza, at least thus far, has been much more prevalent, meaning there's a ton more cases of influenza. Therefore, we have a lot more deaths related to influenza than we have related to coronavirus. So the Centers for Disease Control have estimated that so far in the US in 2019 to 2020, we've had between 20 and 50,000 deaths related to influenza this year. And so you want to put that into perspective of what we're dealing with coronavirus, which is about 2,000 deaths worldwide so far. And so I understand, and I don't think it's unreasonable to make that comparison to say, look, we deal with influenza every year, look at how many people that kills. The difference is the mortality rate associated with coronavirus does seem to be higher than what we see with influenza. So in general, the mortality rate with influenza is around 0.1%. So 1 in 1,000 people that are affected with influenza die from that on average. Now that depends on year from year, depends on the strain of influenza and how virulent or dangerous that is. What we know so far about COVID-19 is that it seems to be between about 1 to 2.5%. But those estimates are very hard because we haven't had good testing to know just how many people have coronavirus or COVID-19. And so it might be that the mortality is lower than that, because there might be a ton more people with coronavirus that just think it's a cold and therefore aren't tested. And so in relation, then the mortality comes down as compared to all of those other cases that we don't know about, are mild and aren't being tested.
So we all get our news from various sources today, lots of different sources sharing things with us. So here's one of my questions. Name a few of the biggest whoppers you've heard along the way about the outbreak of COVID-19 and what we're dealing with today.
Yeah, so I think there are a lot of myths and misinformation that are being spread around about coronavirus. One of the biggest ones is that I would like people to know is that people of Asian descent or Chinese descent are not at any more risk than you or I of having coronavirus. Unless if someone has traveled to areas where it's been a big outbreak, they are not some people to avoid coming into contact with. Another thing that a lot of people have been concerned about is will this spread to children? Coronaviruses are very common in children and spread around schools and daycares, and I think there's a big concern that this could affect our kids. And luckily, this coronavirus seems to be a lot more mild in younger populations than in older populations, which is not always typical. So maybe it's because they have so many other coronaviruses running around, but kids seem to be less severely affected. I also have heard the myth that Corona beer causes coronavirus.
What's that? Never heard of that.
Very not true, although my husband would tell you it's not very good beer anyway.
Yeah, I'm sure there'll be more. There'll be lots more. We got to ask questions. So it's, I'm sure, hard to predict the outbreak and spread of a disease like this. We've had our first case in Minnesota along the way. So how concerned should we be about COVID-19 coming to our little corner of the world? What do you think?
I think, as Jason kind of already alluded to, influenza right now is a much bigger concern in our community than coronavirus. Now that may change, and it's an evolving situation where we may end up having coronavirus or COVID-19 come to our community. But right now, influenza is killing many more Americans and many more people than COVID-19 has.
And I would agree with that, and I think the most important point there is that we need to practice the same hand hygiene and etiquette to prevent both of these diseases. And so washing your hands, hand sanitizer, covering coughs, these things are important to prevent both of these diseases. Now, I agree, I think influenza, much more of a concern right now. How concerned should we be about coronavirus or COVID-19 coming to our community? I don't think we should panic. My feeling is that panic does nobody any good. Do we need to prepare? Yes. Because what we know about this virus so far, it seems to be that we have what we call community-based spread. Community-based spread means that it's not just spreading from one person who knows they have the disease and has been diagnosed and says, okay, aha, I have a test that says I have COVID-19, and then somebody has contact with them and they say, I know exactly where I got it. Community-based spread means that people are getting this disease without knowing whom they came in contact with to get this. So once we get to community-based spread of diseases like this, it's much harder to contain them. And that's where we are right now, unfortunately. So is it likely to continue to spread across the US? In my opinion, and in many, I'm not an expert, but in many experts' opinions, yes, it is. So will we likely see that in our community, or at least in Minnesota? I believe so. But what Terin had said is really important, is that what we know with influenza is that there tends to be a seasonal component to influenza, meaning that when the weather gets good and people get outside, they're not in such close contact with each other, and the infection rates go down. We don't know if that's true with COVID-19 or not, but if it is, then maybe what we'll see is that before it gets here, the transmission rates drop because all of a sudden weather gets warm. We don't know, and that will be borne out over time. But I think we need to prepare, because I think more likely than not we'll see it in our state and in our community.
Yeah, you can hear the phrase, not if, but when.
Right.
So I guess one of my questions is, so draw a picture. How do you anticipate this affecting life in our community?
Well, I think, in my opinion, I think that just like when we have an influenza outbreak, I think it's very important that people pay close attention to their symptoms and stay home when they are ill. Now, certainly with coronavirus, there's been talk of 14 days of isolation. And so if someone is sick, that they stay home for at least 2 weeks. And so that's certainly a bit more than what we've done with influenza. And so it's certainly more of a burden on each of us individually and on our community when suddenly people are at home for 2 straight weeks. So that puts a burden on our schools, it puts a burden on our workplace, it puts a burden on those of us that might be continuing to go to work or involved in some activities and people aren't there. I think that the other issues will be what will happen with community events. Will the things continue as they are? And I don't think we know that. I think that that's been up to individual departments of public health as to whether schools have been suspended, whether community events get suspended. And so will we see a point in Rochester where suddenly sporting events are canceled or schools are out? I don't know. But if they are, I think we need to be prepared for that.
You know, I think it's interesting when we don't know, when there's uncertainty. It's just hard for us to know how to respond to that uncertainty. And we can speculate all day long, I guess. And I don't think it hurts to do a little thinking, but I also think there's a part of us that just needs to go forward and be as proactive and positive as we can be, but realizing we'll need to be flexible along the way. So what are some things we can do on a personal level, perhaps maybe daily, to prevent the spread of this and other illnesses?
Yeah, we've touched on this a little bit already, but just to kind of reiterate, good hand washing, avoiding people that are sick, staying home if you are sick, which is sometimes hard to do. 2 weeks is a long time to stay home from work. But avoiding people who are sick and staying home when you are, coughing into your elbow or into a tissue rather than into your hands. A lot of people have asked me about face masks and if they should be stocking up on face masks. And right now the CDC is not recommending that the general public wear face masks to prevent the spread of COVID-19. We do need those face masks for people who are sick and for healthcare providers. So please don't go stocking up on medical supplies beyond just, or don't go, we're hoping that the community doesn't go hoarding medical supplies because we need them in the healthcare setting as well.
Yeah, I think the real struggle with face masks, people often ask me this question too, is that people don't use them correctly often. Often they take them off while touching them and then touch their face again and everything that they just gained was ruined. And it's just, COVID-19 is just not that infectious. This is not what we call an airborne disease. This is not something that circulates and hangs in the air, as far as we know, for minutes or hours after somebody's been in a room, something like measles was. And so when we talk about infectivity of diseases, we use a term in medicine called an R-naught. And an R-naught just simply means for every person who's infected, how many people will they infect? Influenza is about 2 to 3, and COVID-19 is about 2.5. And so it's about similar to that. Measles is about 22. And so with things like measles, then yeah, okay. And the way that spread, then face masks made a difference. But for this, it just doesn't help. And often people don't use them correctly. And it's getting hard for healthcare providers in some communities to even have access to these.
One other thing you can do is get your flu shot. So again, flu is bigger in our community right now, so that'll protect you from influenza and from that same type of illness that COVID-19 can cause.
You know, it's interesting mentioning the flu. I do senior services once a month. First week of the month, we do it at 7 different places, and it was amazing how many people were missing this time around. I mean, you're right. You go up, there's signs in the door, and wash your hands and be careful. I think I went to the Charter House, I think it was Friday, and they were doing screening on the way in. So they were asking a variety of questions. It can feel like a hassle to answer those questions, but it's so very important to give ourselves the time and give ourselves the pat on the back we need sometimes to take that time and say, this is important for someone to have this information going forward. Yeah. I can only imagine how complicated it's going to be if, suppose schools are let out for a time. Suppose that suddenly there's healthcare workers that have to choose between being at home with their kids versus going to a clinic or the hospital and caring for people. How are we going to figure some of those things out? You two people going to have ultimate authority to make all those decisions? What are we going to do? Good luck on this.
Yeah. I don't have ultimate authority at home, let alone anywhere else. So I'll just start there. But I think this is really tough, and I think that ultimately, as healthcare providers, our first priority needs to be to the care of the public and to our patients. And I think that's what you're going to see. I don't think you're going to see healthcare providers shirking their responsibility when these things come around. And so, what we'll need is some sort of support for those families or those children, whether it's the friends, church support groups, whatever it can be. The question is, what can we do as a community to support each other if these things come to pass? And so, yeah, we need those healthcare providers, we need doctors, we need nurses, we need all the other allied health to help run those healthcare systems. And so one question we can ask ourselves is, what can we do as a church community to support those who need to make that happen?
So, related to that, so what are some things we might consider as a church to be about the effort of taking preventative measures? Thoughts on that?
Yeah. Well, I think the first thing is we need to wash our hands. We need to make sure as much as we can that we have hand sanitizer available in the church as much as we can. And we might want to consider a moratorium on handshakes. And I think...
Did you say handshake?
Handshakes.
I thought you said dancing at first.
Dancing. We're Lutherans, we're not Baptists, so I think we can still dance.
Just checking.
Yeah.
So handshake, yeah, we kind of said that at the first service.
Yeah.
We said no handshaking anymore.
Yeah.
For now.
Yeah. But a moratorium on handshakes, it feels strange, right? Because this has been so engraved in our consciousness as a way to be polite and a way to engage each other. But this really is an important part of preventing the spread of disease. And so not shaking hands, understanding that as a church community. And then I think the other things is that as people get ill, and this is true of influenza, but also of COVID-19, what can we do to support each other? How can we reach out to help one another? Because if somebody is sequestered at their home for 14 days, what do they need to get by? Do they have enough food? Do they have enough toilet paper, right? That's evidently the big thing right now in some places. But do they need things? How can we reach out? How can we form support groups for each other so that if people need things, we can help get those things to each other? I think that's one of the biggest opportunities we have as a community of faith, is to be able to help one another as we need it in this time of need.
Yeah. And I think naming some of these things out loud. I tried to do fist bumps last week as people were walking out of church. That failed miserably. You put your hand out and you're going to get a hand back. And they're going to expect you to shake it. And so we kind of have to say these things out loud and just give ourselves permission to say, I still like you. We'll be shaking hands one of these days. And, the elbow thing can work. Maybe some churches have passed the peace, putting their hand over their heart and a little bow. There's a variety of symbols and gestures we can use that I think become very important. We don't always have to touch, though. We'll miss that. We really will miss that.
And I think it is helpful for you to give us that permission to do so too. Yeah. Kind of alerts everybody that it's not because I don't like you, it's just that I'm being cautious.
Yeah, I think if we're all doing it, then we don't look dumb.
Exactly.
And we worry about looking dumb. I can't speak for you, but I can speak for me. Yeah, see, I think, Jason, you were alluding to the fact that maybe some people are home. We have a strong relational ministry in the church. Not everybody gets here every week. And so, how do we stay connected? How do we relate to people that aren't able to be here without putting ourselves or them at risk? Thoughts on that?
I think Zumbro does a very good job of making connections with people outside of the church, with the sermons being broadcast on the radio, with the Big Idea Guide being available over email, and kind of staying connected that way. I would echo what you'd say, that as a church community, reaching out to each other and kind of asking, is there anything that you need? Is there something I can bring you? Is also a good way to stay connected.
Yeah, let's just put in a word for streaming. More and more people streaming these days, and even when the radio hasn't been working, and that's been very frustrating, I know, for some people, but lots of folks have computers and have tried streaming, I think, to great effect, so that's been good too. So here's a very practical question. What should I do if I'm feeling sick?
I think the biggest thing you can do is stay home. Try to avoid contact with other people and kind of a lot of the things that we've already talked about. If you do start to develop things like shortness of breath, feeling more confused, having chest pain, things like that, a doctor probably does need to see you. The biggest thing that I would say is to try to call in before coming into your doctor. We've put in systems in place to kind of triage people to the appropriate place. There are some symptoms that can be managed really well at home. And sometimes you do need to be seen by a healthcare provider, but we want to make sure that we're ready for you to come into clinic and to try to prevent passing on any illness to other people as well.
You know, so now the really important question. I did a funeral a couple weeks ago for Janet Pedersen, and she comes out of Havre, Montana. She had moved here to be closer to her daughter, and her husband had come with her. And told the story, I think, of right after World War II, right after the bombing, I should say, of Pearl Harbor. They got smart, they went out, and they had been building a house and working on things, and they went out and bought up a whole bunch of supplies along the way. So how soon should we get to Costco and Target? And how many supplies should we be stockpiling along the way? Talk about that.
Yeah. And it certainly is a fair question, and I think part of the challenge is once the hoarding begins, it's hard not to participate, right? Because you don't want to be the person without toilet paper, trust me. And so some of this is very natural, but the answer to this is you should have a few weeks worth of food at home, okay? And so because if you do need to stay at home when you're sick, you really should be at home that whole time. The CDC really recommends that you don't go out in the community if you have COVID-19. And so ideally you have 2 or 3 weeks worth of food that you can eat and stay home with. Do you need a bunch of bottled water? No. We don't have any concern that this is Y2K and that the water is going to stop working. So you should have food. If you want some cold medicine, that's fine, but you don't need to buy up the entire shelf. Because again, this is a disease that typically lasts about 10 to 14 days. And so, you don't need 7 bottles of Dayquil. 1 will probably do fine. And so some cold medication might help with some of your symptoms. But really, that's about it. You don't need face masks, as we said. Some hand sanitizer would be great if you can find it. I know it's getting much more challenging to have, but I certainly recommend if you can find some. You don't need the huge, 50-gallon drum. But to have some available that you can carry with you. But should we be hoarding? No, I think it's part of our responsibility as community members not to overutilize supplies that others may need. And I think that as much as we can to fight that need to go and hoard supplies is really important.
Yeah. And not only community members, can we just throw in as Christians?
Yeah, exactly.
Yeah, it's certainly part of our responsibility to share and be a part of that larger community. Absolutely. So, it is amazing, I think, how certain segments of the population seem more at risk, and we've certainly heard about the elderly. But are there others, too, that are more at risk in these sorts of situations? Maybe people from a different cultural background or have language barriers. How's that working?
Yeah, so first and foremost, you mentioned that elderly seem to be more at risk with this COVID-19. That also includes people with comorbid conditions, so respiratory diseases, heart diseases, other things like cancer that can suppress the immune system. Certainly there would be some concern for people who have language barriers just in receiving medical care and being able to access medical systems. So there's concern there too, especially if they have the more severe forms of the disease.
I think the public gatherings are going to get a little tricky, large group activities, so should we think about canceling church on Easter Sunday? What do you think? I'm just kidding. Just kidding on that one.
I don't want to be responsible for that.
But those are some of the realities. Suppose there were a number of cases that popped up in our immediate area.
Yeah.
And then what do? Are we public? Do we have church? I heard a church out in Suquamish Hills, I think it's pronounced, out in Seattle, a suburb of Seattle, and they are still having their Lenten services, but they're not having their meals. And so I think there's a variety of ways that you can make life simpler. Some churches are trying, this microphone drives me nuts. There are some churches that are choosing to do communion differently. There is a theological principle that if you have one element, you basically have the entire sacrament. So one of the churches out in the Seattle area was just serving bread. We're serving bread during the season of Lent, but maybe bread is too complicated, and so maybe we go back to wafers. I think we'll have to make some decisions along those lines and be flexible along the way. I do think, we talked a little bit, we like intinction as a practice, but it feels a little messier. We're going to serve communion this coming Wednesday as part of our experiment. We need to try it, wash your hands, stay home if you don't feel well. We're going to serve regular communion with individual glasses at noon, and then intinction in the evening. We're going to see more people get sick in the evening. No, I'm just kidding. But we are going to do that. We're going to differentiate because we have to figure these things out too. We don't know how to be the church exactly, and we'll have to take our cues from other folks that are working in the field and how we're experiencing along the way.
Yeah, I think you hit the nail on the head where it's kind of a moving target and a changing situation. So as things evolve and change, we'll have to make decisions about what we're doing and what we can change to keep everybody safe.
Yeah. So we have some extra time. Who has some questions along the way? We have a bunch of questions. We're going to have trouble bringing the mic to you, so we'll just ask you to speak loudly. We'll start with you, Bob.
Well, I actually have two questions. One, for you, Pastor, in the church, you had mentioned as far as helping out, do we have a way for people to easily contact the church if they need help?
That's a great question. Do we have a way to easily contact the church if people need help? And, talking about building bridges of understanding and peace, that's going to get put to the test. We don't know. We're making this up as we go. We're certainly taking our cues from what's happening out there. But that's a great point. Pastor Shelley's back there. Take a few notes, would you? That's helpful. So we need to work on things like that. Yeah.
And my second question is a personal question, and it has to do with travel. Beginning of April, we plan on going to France, southern France. What would you advise?
This is not for me. I think we have a group from church that's over in Portugal right now. And so, what do you think?
Yeah, and I think this is really $1 million question because it really comes down to a risk-benefit analysis for each individual person. And so, right now, the Centers for Disease Control has different levels of risk for different countries. And really, there's only a few countries that are high risk. So the absolute recommend against for all people are China, Iran, and Italy. Avoid, and the one that's avoid if you're high risk of disease, so if you have comorbidity. So I'm sorry, the question was, have a travel plan to France in April, and should we go? The second level is Japan, which they recommend avoiding if you have comorbid conditions, so if you have chronic lung, heart disease, etc. And then the only other one that makes their list is Hong Kong, which is just, you're probably at a bit higher risk there, but just use normal precautions. Outside of that, the CDC doesn't differentiate France from anywhere else. Now, could France be a hotbed in April? Possibly. I mean, maybe it will move from Italy to France, but if it's me and I don't have a lot of comorbid conditions, I probably would go with the CDC recommendations. The CDC says that airplanes are probably not a high-risk place to catch this disease because of the way that the airplanes filter the air and the way the air recirculates. And so as long as one is practicing good hand hygiene on the airplane, one is probably okay. And then again, it's just about practicing good hand hygiene when you're at your destination. And so for now, that would be what the CDC would recommend and probably what I would recommend. I would tell people not to stop living their lives at this point because whether you go to France or you wait for it to get here, it's probably going to be everywhere and we're likely to be exposed to it at some point. And so it's just taking the standard precautions is the best we can do.
Okay, thank you. Rolf?
I have a couple questions. What is it that coronaviruses share to make them part of the same family? And what is it that makes this virus different to make it stand out? And the second question is, If hand sanitizer makes me sneeze, should I use it?
So the first question is what do coronaviruses share that makes them the same and what makes us different? Coronaviruses all have a ring-like structure of the virus particle, and corona just meaning like a ring, that's why they were named like this. Now, all viruses can have some slight differences in the structure which give them different appearance to one's immune system and slightly different ways that they affect one. And this COVID-19 just happens to have slight mutation compared to other coronaviruses, but there are literally thousands of coronaviruses out there. And so we keep getting the common cold because we keep getting different coronaviruses. If it was just one, we'd get the cold once, like we get mononucleosis or Epstein-Barr virus, and then we'd never get it again. And should you use hand sanitizer if you sneeze? If it makes you sneeze, I would say I would still use hand sanitizer. There might be some that might be scented differently than others that you might be able to try. But the most important thing is if it does make you sneeze, to cover your sneeze for the sake of those around you. And hopefully it doesn't make you sneeze forever, just a few times as you put it on. But still it's important. And if that's too hard, just soap and water is also fine. And so we don't need to use hand sanitizer. We can just use regular hand hygiene with soap and water. It's just less convenient.
I got one other thing I learned when I was in high school. We did a test in a biology class where we went into the bathroom and washed our hands, and then we came out and did a test. It made no difference, the ones that washed in the bathroom versus those who didn't. So I think the point is we didn't wash long.
Right.
Yeah, that's a fantastic point.
What is it, 20 seconds?
Yeah.
Yeah, I'm sure you're all better at that than me, but it's really hard to take that much time and to have warm water to begin with and to just let it settle in and work on it. Yeah. Other things, we got one right here.
I've heard that this virus has mutated already, and what are the consequences of that in developing future vaccines?
I have not heard that it has mutated. I think there has been some concern that it has morphed into kind of two different COVID-19s. That will be an evolving situation for people creating vaccines and treatments for COVID-19. Again, there are thousands of coronaviruses out there, so there are many, many different forms that we can have. I don't know the answer to whether or not it is the COVID-19 itself has mutated and if that has changed the nature of it.
Lyle's been raising his hand back there. Lyle?
One comment, Pastor, on your communion down here. I don't think this is the time to experiment with something. Second question. I read an article that this started from bats. What do you know about that?
Yeah, so the question was, read an article that this started from bats. And certainly most of the other coronavirus outbreaks, so MERS and SARS, certainly did have a bat host. And so those we know started from bats. I have not read or confirmed that this came from a bat. I know that it was the question if this came from a wet market, which is the market in China where they sell some unusual animals. And whether it was a bat or another host, I'm not sure, Terin, do you know exactly what it was?
No, I don't know that they've known the exact animal that it might, and that's just kind of hypothesis right now that it did come from an animal. One other myth that I have heard though is that we can transmit the COVID-19 virus to our pets. So far from my reading, and there's been no transmission from humans back to animals. So feel free to keep your dog at home with you and snuggle with you if it gets sick.
Well, and they're good for getting us to feel better.
Yeah, but that is a concern though because other coronaviruses can be transmitted to pets.
Okay.
And so that's why, and the CDC does recommend while you keep your pet at home to try to distance yourself a bit from your pets, just because of the risk of other coronaviruses passing from humans to pets. Pets are known to be able to contract human coronaviruses, so we can pass those back and forth. And so the CDC says that's fine, just try to isolate yourself when you're at home, including from family and pets, is what they say.
All right. Maybe time for a couple more over here, Rich?
We see on television news reports that over in Asia, public health officials are spraying down public areas with something. If this is a communicable disease, what are they accomplishing by doing that?
So the question was, in Asia, they're spraying down areas to try to disinfect things, and if it's a communicable disease, what does that help? Certainly, if there's an area that somebody has a coronavirus, they sneeze, they cough, they touch something, somebody else touches that, there's a risk of transmission, because those respiratory droplets that contain somebody's saliva, mucus, those can get transmitted to a table, handrail, and somebody else can pick those up, touch their face, and contract the disease. The question is, how long do those live on those inert areas? We don't know the answer, but certainly it is a good recommendation to disinfect commonly used areas, and the Centers for Disease Control recommends that. And so it probably when you're going through a public area, avoid touching things that one doesn't need to touch, and sanitize our hands or wash our hands when we can. Is it worth going through and spraying everything? I don't know, because you're probably right. The vast majority of these are probably not getting contracted through touching something that somebody else touched, but I think people are doing what they can to try to help.
By the way, this is an aside, but we are using, our custodians are using a lot more sanitation efforts around here on a proactive kind of basis. So did we see a hand back there? Yes?
So tomorrow I come down with symptoms, I'll self-quarantine myself at home, which doesn't take a whole lot of effort. So how do you guys, how does the medical community make that diagnosis? Do you send me the 1-800 number? Do I put my finger in the computer? How do we do the test?
Yeah, so the testing has been delayed, and that's been part of the problem. And so we do at the Minnesota Department of Public Health have test kits available. I don't know that Mayo has their own test yet. I don't believe so. And so the testing is a challenge right now. And it has not been rolled out. So the question again was, how do I get tested? The tests have not been rolled out as plentifully as one would like in the healthcare system. And so certainly call in though, let your doctor or nurse practitioner or physician assistant know what's going on, because that may vary day by day. We may get test kits on Monday that we didn't have on Friday. And we are going to want to test community members based on their risk of disease. Now, again, this is all based on risk. And so do we want to test everybody for COVID-19? No, ideally what we do is test everybody for influenza first, because it's much more likely they have influenza. And then if that's negative for influenza, then okay, maybe we test for COVID-19, because we want to save on those COVID test kits if we can.
I have to go to a baptism, but I want to thank these two, and then I think if you want to talk to them individually, I'm going to hand sanitize my hands before I do this baptism, just letting you know. But it's just that reminder, we think about those things and the simple things we can do, very, very important along the way. Let's make sure we give Jason and Terin a round of applause for